Thank you for joining in, everybody. Tomorrow is Cancer Day, and so we decided to have a small talk with Dr. Tahir. He's done a lot of work for all doctors, educating all the doctors about cancer and cannabis-based medicine. So today we just decided to have a small talk which is easy to understand for everybody about new therapies and conventional therapies for cancer. So shall we begin, Dr. Tahir?
Yeah.
So Dr. Tahir, you know that cancer is growing very, very fast, growing at a very fast pace. And a lot of people are aware about the side effects of conventional modes of treatment, radiation and chemotherapy. So they're always on the lookout for new therapies, alternative therapies. Can you just talk about something on those lines?
I think first thing is, once you're diagnosed with the disease like cancer, you don't have to get scared. There are many ways to deal with it. Okay. So like the conventional therapies go with chemotherapy, radiotherapy, surgery if needed. And also they've started with targeted therapies. So you have the range with us. You can use any of these ranges. And depending on the oncologist and the patient, I think they decide after examining and going through all the reports. Like for example, once you're diagnosed with some tumor, so they do some tests like CT scanning, PET scanning, then they do biopsy, then they do biopsy testing in the form of immunohistochemistry report. And then they may also test some blood reports like tumor markers and all. And after that, they arrive at a diagnosis saying that this is this cancer and this at this stage, that's what they do. And once they arrive at stage, it's for the oncologist, this staging. It is not for us to understand. Just because somebody has stage 4 cancer doesn't mean that we have to get scared and it is for stage 4 cancer. What can we do? It is for them. So for each stage, the therapies are different. So depending on that, the oncologist will decide and pinpoint. Recent times, I think, because of the heavy investment from the pharma and also because of the action that we saw in the initial studies, these target therapies have become a norm nowadays. So I think if you see that for every cancer now they have a target therapy, and this target therapy is a new norm that most of the people don't. So this is a sort of immunotherapy. So, and also they use some other things also in that. Like for example, the target therapies are two kinds. One is based on monoclonal antibodies or like immunotherapy, and another one is they block some small receptors. So they target certain parts of cancer. Like for example, when you have a given cancer at a given organ, okay, say for example, somebody has a lung cancer. So lung is coated by a layer of cells, which we call as epithelium. So this epithelium helps the body to absorb the oxygen and give out the carbon dioxide. So this epithelium are of many types. So there is the normal epithelium, which lines from the nose till the trachea. Then you have the epithelium, which we call as alveoli. Then you have small cells inside lung. So depending on which part of it is having the cancer. And cancer simply means overgrowth of cells in one place. So it's a definite definition for cancer is it has to be overgrowth, and the overgrowth has to be uncontrolled. So those things actually make up what we call as cancer. And then for cancer, there is one big mass, and then you have different sites which can act as a stimulant for the growth of. So like, for example, there's a basic mass of cancer, and then you have different sites on this, which we call as the LOX, the receptors. So these receptors, depending on what it is. Like, for example, when it comes to lung cancer, so there are a variety of things. So if I just look into the book, because lung cancer has the most depth in target therapies, and they have lots of drugs. So like, for example, there are EGFR inhibitors, epidermal growth factor, inhibitors. So they target only that part of cancer. So if that part in biopsy report shows more, then they use that. Then there's something called as tyrosine kinase inhibitors, which they use to target one small kind of people. And then we have drugs that specifically target for other mutations, gene mutations. Like we have KRAS mutation. So there's a whole set of it. So I don't want to go into too much. But as we know that there are so many, like for example, the book says 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So right now, as of today, we have 10 targets for lung cancer. So you have 10, if those targets are active, so they may include that. So target therapy is a new norm, and it has taken a big turn when it comes to the therapy. Yes, Ranika.
So, doctor, is this can this be taken as the first line of treatment for any patient?
The oncologist will decide based on this, but usually the first line of treatment is always like chemo, then radiotherapy, and then they give surgery, and after that only they go for immunotherapy and target therapies. But if the cancer shows really some good amount of targets, like for example, if EGFR is really very, very positive in that lung biopsy, then he may introduce the EGFR inhibitors as a target therapy along with the normal therapies. So we leave it to the oncologist to decide on that.
So you're saying that target therapy can be taken in conjunction with conventional treatments like radiation?
Yeah, they do. Some of the bigger hospitals, like for example, Tata or in max 40s hospitals, they have this proformas now, protocols now, where they can include the target therapy along with the chemotherapy. Or sometimes they may alternate. They may give chemo, then they may give target therapy, then they come back to chemo, and they do that.
And can target therapy be used for all types of cancers and all types of patients?
Again, it will be decided by the oncologist. But yes, I think, for example, in breast cancer, they target the estrogen, the progesterone, the HER2 receptors. So they target that. So you see that sometimes if that person has ER/PR, HER, or triple positive cancer, so they may, along with the the cytotoxic or chemotherapy, they may include estrogen blockers and also the HER blockers.
So from a patient perspective, how different is this? The patient will wonder, how am I supposed to take this therapy? Is it intravenous, or is it taken orally?
So most of the target therapies are intravenous therapies for now. Like, for example, the most commonly used for breast cancer is trastuzumab, which blocks the HER. So it is a monoclonal antibody that actually blocks the HER receptor. So that is, and you have the salts of like denosumab, all the salts of trastuzumab and the likewise. So this thing is usually given as an IV once in 3 weeks, or sometimes, if the tumor growth is really bad, they may even give it in the form of weekly.
So everybody here knows that, Dr. Tahir, you are an encyclopedia on cannabis-based medicine. So how do we compare target therapies with cannabis-based medicine? Can they be taken together?
Very interesting question. Okay, so like, for example, I have already presented to some of my friends and also to the oncologists that we can use medical cannabis as a targeted therapy. For example, now we know that there is endocannabinoid system, right? And in that endocannabinoid system, you have two locks, which is CB1 and CB2 receptors. They sit in our body, and whenever there is demand, then those locks increase. So for example, in cancer, so like, for example, I'll show you a presentation so that you can understand a little better. So this is the receptors that can be targeted. Okay, so you have CB1 receptor, you have CB2 receptor, and you have another receptor that is TRPV1. The CB1 receptor has been related to the viability effect of cancer. So like, for example, it increases the cell viability. For the cell to stay intact and whole, CB1 receptor activity is needed. If the CB1 receptor activity is good, like endocannabinoid state or the balanced endocannabinoid state is there, then the CB1 receptor activity will be so well that the person may not develop cancer at all. So that is one thing. CB2 receptor, which sits at the inflammatory sites, it creates apoptosis in cancer cells. It kills the cancer cells. And TRPV1, or what we call as transient channel receptor potential V1 or capsaicin receptor, it is responsible for the inflammation that the cancer causes and also for the invasiveness, the way the cancer spreads across. So now we know, this is the research that shows us that the CB1 receptor is also there in the cancer cell, the CB2 receptor is also there in the cancer cell, and the TRPV1 receptor is also there. So if we give cannabis, we can target CB1, CB2, and TRPV1, thereby keeping the healthy cells more healthier and killing the cancer cells and decreasing the inflammation and decreasing the cancer invasiveness. So this is what we know as of today. So then we can use medical cannabis as a targeted therapy so that we target some of these things. Like, I'll show you one more paper that I have as of now. So in this also, you see the presentation. In this also, I've talked about lung cancer, okay, breast cancer, and brain cancer. Okay, so these are the 3 cancers about which we know. So we can target this. So when you target when we use the medical cannabis, we can target lung cancer for apoptosis. Through CB2 receptors, it can bring about apoptosis. Through CB1 receptor, it will arrest the cell cycle. It will not allow the cell cycle to go. It will not allow the cancer to multiply into 2, right? Same effects we see across all the cancers. And the most important thing is, the increase of reactive oxygen species level that we see in every cancer. That also can be induced, or it can be modulated by the help of the medical cannabis. And even in colorectal cancer, we know that, under the effect of CB2 receptors, it can cause autophagy or programmed cell death and apoptosis through the CB2 receptor. So we now know it is so evident. And also, I'd like to show you another paper. Okay. So if you see in this target therapy, so malignancy is demonstrating expression of CB1 and CB2 receptors. So this can be used as target therapy here, medical cannabis. Now people are trying, like, for example, in lung, CB1 and CB2 receptors are there. In glioma, CB1 and CB2 receptors are there. In thyroid, CB2 receptors are there. Lymphoma, CB2 receptors are there. In skin, again, CB1 and CB2 receptors are there. In pancreas, CB1, CB2, and TRPV1 receptors are there. Same thing we see in endometrium. Same thing we see in breast cancer, and especially in triple negative, the worst kind of cancer that we have. There are plenty of CB2 receptors, and that can be targeted by medical cannabis. And what this paper also showed was any kind of aggressive cancer. If the cancer is really bad, really aggressive, there is increased expression of CB1 and CB2 receptors. So if the cancer is bad, then the chances that medical cannabis can be used, and we can use it to handle and use it as in the form of target cancer, and specifically the CB1, CB2 receptors is great. And I think we should utilize. That's what we have been doing in our practice.
Dr. Tahir, does mainstream medical fraternity include cannabis-based medicine do they recognize it as a target therapy?
At least in India, I have not seen that, but yeah, I've interacted with people in West, especially the North America, not specifying any country there. So North America, I have seen some of the doctors that did presentation where they have used low dose chemotherapy along with medical cannabis, and they have used it in conjunction to get very good results without the side effects coming into play.
Do we still have time?
Yes, yes.
Okay. Can we talk about once the cancer is in remission, the preventive measures? Because I think that's very important, and to prevent a relapse.
So I think chemoprevention is another word that we use for, okay, so that we use certain chemicals, it may be biological, it may be chemicals. So like, for example, this to prevent breast tumor, they use tamoxifen, which blocks the estrogen receptors. So if the estrogen receptors are blocked, it will also, keep the cancer away from coming back. Though again, when you look at the incidence and the epidemiology, we know the effect is somewhere close to 50 to 60%. But if you rectify the diet and we use medical cannabis, because cell viability is something that no medicine can do. Cell viability is something which food does, and with certain biological things like resveratrol, it increases the cell viability. Then there is this black seed oil, thymoquine. So that also helps in cell viability. So if you use these things, so we have a plan, we have a particular protocol for every cancer, whereby we look into the biopsy reports, look into the IHC reports, and thereby we devise a particular protocol as chemoprevention, so that the cancer doesn't come back, the cancer remains in remission. So, and that has better effects than just chemical chemoprevention. Like, for example, using tamoxifen to prevent breast cancer. So that can be done. And before I conclude, I would like to ask you, apart from the usual causes that we see, right? Since you are healing and you have been doing energy work, though it sounds very odd for a normal person, right? And also for the medical fraternity, but mind-body healing is where the magic occurs, is what the integrative medicine principle actually told. So if mind-body medicine is where the magic is occurring, so what do you think about the mind, the psychology in any given cancer, and what do you think may be the important aspect when you do with the mind-body?
I think the emotional component is very strong with patients who have been suffering from cancer, and I think mainstream medical fraternity is now beginning to recognize the psychosomatic factors related to cancer here. So a lot of emotions like bitterness, guilt, anger, suppressed emotions are something that all the patients that I've been working with on the energetic level, they have shown the same kind of suppression throughout their lifetime. So whatever trauma they have gone through, apart from the social dynamics, the family dynamics, what they have felt, a lot of bitterness, guilt, suppressed emotions have been the underlying cause before they began to feel sick, or when before the diagnosis. So this has a very strong I think root cause, which everybody, I think all the doctors should also try to realize, that cancer is not just a physical disease, but rather an emotional dis-ease as well. So we need to work with the patient to understand their emotional well-being.
Thank you. And I think I would like to mention about Richard Hammer, who did some experiments on psychological aspect and all. And he always used to say that there has to be some deep psychological conflict before the manifestation of cancer. So my dear friend Nitin has joined it. Nitin sir, namaskar, welcome. Sir, आपका अनुभव क्या बोलता है about preventing cancer with Ayurveda or Ayurvedic herbs?
Yeah, so basically, cancer, Ayurveda medicines and overall lifestyle changes will definitely work like a onco-preventive or chemo-preventive measure. If you recollect, in 2005, one article was published in Lancet that said that what is the chemo prevention? So chemo prevention is something which can prevent the initiation, progress, and the spread of the cancer cells. So there is a triangle. Healthy individuals, they are the first. Then individual with the family history. Okay, so they are high risk. Plus those who are having consumption of alcohol, smoking, tobacco, etc. The stress factor, yes, high risk. Then pre-neoplastic lesion, then neoplastic lesion, then treated. So this was the pyramid in that Lancet journal it was given. So chemo prevention plays very important role in the cancer management, without which cancer treatment is not complete. As per the article from Cancer Journal 2019, they clearly say, the Norwegian study, it clearly states that almost 2/3 of the patient, the solid tumor, they die because of the relapse, not because of the primary tumor. Stress, as madam rightly said, the chemo resistance also causes the relapse. So these are the things which are essential. And Ayurvedic medicine, especially the cannabis, is wonderful, I feel, to prevent this kind of relapse and metastasis. Definitely. Yeah.
Thank you. And our dear friend, Dr. Chitranshu is also there. So Dr. Chitranshu, what do you say about using like curcumin or ashwagandha or any of those herbs as prevention in cancer?
Yes, sir. Good evening, sir. Sir, like we have seen, there have been established studies about anti-cancerous role of curcumin. We have seen, and ashwagandha is one of the very most important medicine, as ma'am has rightly stated, that there is a connection between body and mind and soul. So ashwagandha, what it does is it brings the balance in the brain, and hence improving the quality of life of a person. So yes, many medicines are there which majorly includes curcumin, ashwagandha, shatavari, etc. These are very important in maintaining these the quality of life of a cancer person.
Yes, thank you, Dr. Chatanshu. So before we end this, any final words from you, Dr. Tahir?
Sir, I have a question.
Yes, sir.
So I agree that the mind-body component is very important in the causation of the disease, and once the disease happens, in terms of to help the patient cope with it, and as a form of prevention as well, lifestyle management. What tools do we use currently, or what tools are available for us to help the patient to get that emotional connect back? For example, my question is, should we be using things like psychotherapy or hypnotherapy or clinical hypnosis? What are the tools which we can offer the patients, or where we should signpost them for this kind of issues? If anyone can elaborate on that, that'll be great. Thank you.
So yes, a lot of psychologists are using hypnotherapy as well. There are lots of hypnotherapists who work with the patient to, break into the critical factor of the mind, the subconscious mind, just to reveal what the hidden traumas, suppressed emotions have been. And apart from that, there are other modalities which are not really recognized by a lot of people, but things like guided meditations, bringing them into an awareness of their own feelings, their own reactions, yoga, music therapy, sound therapy, all these can play an important role, but one therapy may not work. So this is, I think we have to form a collective protocol where whatever the patient is understanding, or emotionally connecting with, that sort of a therapy can be practiced with the patient.
Great. Okay. Thank you very much.
Thank you. Dr. Tahir, over to you. We wanted to have
just to conclude, I think if you look at the Society of Integrative Oncology guidelines, right, for the mind body, so they say that you can use energy healing in the form of pranic healing or Reiki healing, or even the chakra work. You can use yoga, music therapy, and they have found that there are definite articles which show that for the post chemotherapy issues, music therapy is really doing justice. And music therapy also takes you into that state of mind where the emotions come out easily. And as Ranika rightly said, so one tool is never enough. The more tools that we have, and depending on what the openness of the person is, we can use. Even the simple stretching exercise, if somebody doesn't want to do yoga, some people are like, yoga. So they say, yoga, it's cancer me. So they say like that. So you can just ask them to do simple stretching exercise, lymphatic massages, that all, can help in understanding the trauma, psychological trauma or psychological conflict that the person has, and then we can actually heal them out of it.
Sir, in Tata Memorial Hospital, Dr. Badwe, he has conducted a long research on the effect of yoga on the breast cancer, and definitely quality of life was better, and they had longer disease-free, the disease-free remission. So this is established and documented in Tata Memorial Hospital. So you are rightly saying that yes, it makes difference.
Yes, sir. I think many more studies are there. We can discuss in another question. So Dr. Mahesh has joined in. So he's our Ayurvedic doctor from Bangalore. Sir, any words from you?
Yes, sir. So good evening. I was a bit late to the presentation of yours. Sorry for that. And off late what I have heard, I agree that there are a good number of drugs mentioned everywhere, irrespective of which science we are, whether it is modern system or Ayurveda or yoga or whatever. It's quite natural that ultimately we need to give the relief to the patient or a cure to the patient. I don't bother. We should not bother whether it is from Ayurveda or whether it is for any other science for that aspect. This is first thing what we should really work on an integrated approach. Integrated approach, it doesn't mean because if we can just go into a bit back, say around 4 or 5 decades back, they tried this integration with Ayurveda, but it failed miserably. But I mean, with many reasons for that, like availability and things like that. Today, Ayurveda also has good dosage forms and many other things like that. Now it is a good stage for integration where I think we can give a better approach to a particular condition like cancer, especially where individual systems have not fared very well. They have failed one or the other way. Agreed that we from Ayurveda have given a better life condition to the patient who is suffering from a cancer. Incidentally, I had an opportunity to treat only 2 people in my clinical practice because people approaching us for Ayurveda is very low. So that was CA prostate and the other one is CA of urinary bladder. Both these patients, they passed away, but they had a better life after chemotherapy. Their life quality of life improved with medicine, and it was like Amrita Ballatka, which I used, then certain capsules like Cruel capsule of Unja Ayurveda Pharmacy. So these are some medicines which we have, and they improve the quality of life, which I have very clearly seen it. Other than that, we have certain limitations. Now, after getting introduced to this world of cannabis, I think we have one more within us. So I think we should be able to, in an integrated way, we can give a better life to people rather than, I'm sorry to say, Dr. Tahir, please excuse me, chemotherapy, they've made people miserable many a times. I'm sorry. So, but this is the fact which I think the other fraternity should understand. And it's always together that we can give better results. This is what I feel. And I'm sure that even you feel the same, because when I've heard you back. So I think that's the need of the day and future is integrated and well coordinated approach, not masking the other systems. And that will give the best thing, whether it is a aromatherapy, music therapy, any therapy for that matter, whatever that is beneficial to the patient, because every patient is a different world of his own. And the medication cannot be like 1 + 1 = 2. I always tell my patients, it's not mathematics, it is biology, where 1 + 1 = 3 or 1 + 1 may be 0 also. So you cannot be saying that 1 + 1 = 2, that is it. So we need to understand that. And I think that's it. Yeah. So thank you for the
Dr.
opportunity.
Yeah, thank you, Dr. Vash. And we are approaching the public as such after this talk. So, so I thank you all for joining for that small tidbits. And I hope, we can do much more better with the integrated approach.
Sure, sir. Sure.
Thank you everybody for joining in. And maybe next time, Dr. Tahir, we can ask some of the patients who refused chemo, radiation, are going through meditation and other healing processes and talk about their experiences. I think we need more of them to come up, some inspiring stories we do have with us. And yes, I love one thing that Dr. Mahesh said, that this is biology, not mathematics. And I think this really, really makes people understand this whole concept very well. Thank you once again, everybody, for joining in. Thank you, Dr.